Hi, I am Dr. Elo, one of the elite ICE 50 avatars to present this course on million-dollar settlements. First case, a New Jersey medical malpractice lawsuit filed over the wrongful death of a 21-year-old man. He had a genetic condition which should have precluded him from receiving oral surgery. The dental malpractice lawsuit was filed by the family of Francis Keller in the Superior Court of New Jersey for Middlesex County against Dr. George Pflugrad, an oral surgeon from Perth Amboy, New Jersey. After having his wisdom teeth extracted by Dr. Pflugrad on August 4, 2005, Keller suffered a reaction to the surgery that caused his throat to swell, eventually causing him to suffocate to death. The Central New Jersey jury found that Dr. Pflugrad was medically negligent for performing the dental surgery, knowing that Keller had a hereditary condition where any trauma to his face or hands could cause his immune system to react, resulting in swelling of the hands, face, and airway. The immunity disorder should have precluded Keller from having the surgery or other dental work. Although Dr. Pflugrad attempted to place the blame on the family's dentist, the jury found that Dr. Pflugrad committed medical malpractice for performing the dental surgery on Keller without getting medical clearance. Keller's family was awarded $10.2 million for his wrongful death. It is believed to be one of the largest awards oral surgery malpractice verdicts in the United States. Second case, $4.50 million settlement in dental malpractice case in suburban Philadelphia County. Attorneys Carol Nelson Shepard and Patricia M. Giordano represented a 38-year-old divorced father of two young children who was initially seen by defendant oral surgeon for an abscessed tooth, which had resulted in severe pain, swelling of the face and neck, and inability fully to open his mouth. Attorneys Shepard and Giordano contended that given the severity of his symptoms, the defendant oral surgeon should have ordered a CT scan to assess the magnitude of the problem, and further, should have admitted him to the hospital for institution of IV antibiotics and close monitoring given the potential for compromise of his airway. Instead, he was advised merely to return in a week for extraction of the affected tooth. By that very evening, plaintiff's condition worsened to include also fever and chills, for which he presented to the defendant hospital defendant physician also failed to order or have performed a CT scan, and instead merely admitted him to the defendant hospital under the care of defendant hospitalist. Defendant hospitalist, suffering from a significant lack of knowledge, experience, and training with regard to severe soft tissue infections of the face and neck secondary to a dental abscess, also failed to order or perform a CT, failed to appreciate the risk of respiratory compromise, and failed to admit plaintiff to a monitored floor for that reason. Instead, the following afternoon, on a routine nursing check, the plaintiff was discovered blue and not breathing. Despite resuscitation, plaintiff suffered severe hypoxic injury to his brain, requiring 2 years of hospitalization, rehabilitation, and nursing home care, and resulting in permanent spastic quadriparesis, requiring him largely to be confined to a wheelchair and with significant difficulties with speech and activities of daily living. The case was settled for the sum of $4.5 million following jury selection and opening statements. Legal release. The views expressed in this article do not necessarily reflect those of ICE 50. One must consult with their legal and financial representatives for any and all legal advice.